When we talk about neurodegenerative diseases, we often focus on the signs, the symptoms, and the search for cure. But there is another dimension that affects millions of lives: economics. These diseases, slow moving and relentless, don't just erode the brain, they erode financial stability, chipping away at the resources of families, governments, and healthcare system alike. The toll is heavy and rising. Alzheimer's alone crossed $1 trillion mark in the global economic burden by 2023, and that number is expected to double in just a few decades. AI projections suggest that without intervention, we are headed toward a global caregiving crisis. In the Gulf, where government subsidies cushion some of the blow, families still face enormous out-of-pocket expenses, especially for long-term care, specialized treatment, and loss of income due to full-time caregiving responsibilities. In theory, healthcare systems and insurance should cushion families from this cost. In reality, most plans fall short. In Gulf nations like Qatar and the UAE, public systems offer partial relief, but not all the services, especially specialized therapies or private facilities, are covered. In Saudi Arabia, while citizens receive free public health care, experts often face steep bills for long term care. Private insurers, both regionally and globally, often classify neurodegenerative conditions as chronic, imposing tight caps on benefits. AI based tools are now being tested to streamline claim approvals and identify more effective care options for patients. But regulatory frameworks are still catching up. Until then, families are forced to navigate the patchwork of support, often without knowing the true cause until it's too late.
So, what can we do? Governments must expand healthcare coverage for neurodegenerative conditions, not just for diagnosis and acute care, but for long term support. Insurance companies can no longer afford to ignore these diseases. Updated policies for chronic conditions, backed by predictive AI models, can create more realistic and humane coverage options. On the tech side, early detection through AI could dramatically reduce costs. By diagnosing diseases earlier, sometimes year before symptoms, AI can help delay progression and cut treatment expenses. For families, tax breaks, caregiver stipends, and workplace policies that support flexible care roles can ease both emotional and financial pressure. So, the future of neurodegeneration care isn't just medical, it's economic, social, and digital.